Hello, good morning. This is Rhoda Stevens, family nurse practitioner and owner of Jordan Family Clinic in Fort Worth, Texas. Happy Friday. I hope you're having a good day. This is May 1st. I really wanted to stop by and talk about something that I meant to talk about in April, but life happened and I just didn't get a chance to have this conversation. Regardless, I think it's important and relevant no matter what time it is. So I wanted to make sure I have this conversation today before I do anything else. So April was Minority Health Awareness Month, and it's April every year. And why is there even a Minority Health Awareness Month? It's simply to discuss the health disparities and the health issues that plague minority populations disproportionately, right? Let's just put it that way. It's a month that was set up to bring awareness about the issues that affect minority populations more than other racial groups. Now, as a Black female myself, I can say firsthand that these issues need to be talked about regardless of what month it is. So even if it's May 1st, I still wanted to have this conversation because it's very, very important that this discussion is had. Let's just put it that way. So who are those who are considered minorities? Let's just clear that out first. In the US, there are four main ethnic groups that are considered minorities, four main groups. One, African Americans. Two, Hispanics. Three, American Indians and Alaskan Natives, and four, Asians and Pacific Islanders, right? Those are the four main groups that are considered minorities here in the USA. Now, what kind of issues plague minorities more? I'm gonna be a little biased and talk more about the issues that face African Americans and Hispanics, because based on personal experience in my career, those are the two main groups that I've seen to really suffer from a lot of the issues I'm going to talk about. One, studies show things like obesity, high blood pressure, diabetes, heart disease, right? More affects this minority groups, especially African Americans, more often. Okay, and let's not even go into the maternal mortality rate, right? I think it's been well established that Black females have a higher maternal mortality rate. But regardless, why do these populations tend to experience these health issues more often, right? We can talk about so many things, from as simple as, culture to education. But the one thing I want to bring out is I read an interesting study that said, 88% of Caucasians have health insurance coverage, as compared to 79% of African Americans and 68% of Hispanics, right? And it's even less when we get into the other populations. So right there and then, we do know that people with health insurance or medical coverage tend to get care a lot sooner and get better care. That's a fact. And when these populations have less medical coverage, they tend to avoid going to the hospital or going for care unless it's too late. Working in the inpatient setting for several years, it really, really broke my heart to see time and time again Hispanics or African Americans coming in with end-stage renal disease or kidney disease from issues that are preventable. Now, I know genetics is factored into high blood pressure and diabetes, but a lot of times if it's diagnosed and managed early, we can mitigate some of the organ damage that happens because of these diseases. Diabetes and high blood pressure are the two main causes of kidney disease, right? That's a fact. Now, if these populations experience these issues more frequently, it makes sense that they will come in with kidney disease. But once you get into kidney disease, it's because you've not controlled some of those issues. And a lot of times, by the time they get to us, they're finding out for the first time. High blood pressure is known as the silent killer for a reason. You might not have symptoms, and your blood pressure is 180/110. Not everybody has symptoms with it. I've seen patients who come to follow up with us from the ER simply because they went in for something completely different and they were found to have very high blood pressure or diagnosed with diabetes and they had no clue about it. And these are young people. So it breaks my heart that a lot of young people, especially minorities, could be walking around with some of these health issues and don't even know about it until it starts hitting your organs. Then you come in with congestive heart failure, and you come in with chronic kidney disease or end-stage renal disease needing dialysis from something that could have been prevented in the first place. I could be on that soapbox for a while, but that is one of the main reasons why I actually opened my practice, because so many people avoid care, so many minority populations especially avoid care, or uninsured people, right? Avoid care until it's too late. And then we're working hard at the back end to fix something that could have been diagnosed a lot earlier, which makes it easier to manage, right? Now, this is an interesting study that I read. 46% of non-elderly African Americans have more than one chronic health problem. And when I talk about a chronic health problem, it's like diabetes, high blood pressure, heart disease, thyroid, stuff like that. So 46% of non-elderly. Now, non-elderly is people who are less than 65, right? So you and I, a lot of young people, almost half, are walking around with one or more chronic issue. Now, these statistics are taken from the people we know about. So I strongly believe there are a lot of people that we don't know about walking around with one or more chronic issues that might not even be part of the statistics. And that's heartbreaking for me. And if we don't fix it, we're gonna end up with a pandemic, right, in the future, of renal disease or congestive heart failure or heart disease because of extensive damage from uncontrolled diabetes or high blood pressure. So anyway, that's a soapbox and a rant I can have for a very long time. But what can you do, right? This is an ongoing conversation, whether it's April, May, or whenever it is. Because if you find yourself in one of these minority populations, trust me, you or a family member is dealing with this issue long term. So what can you do? Educate yourself. If you've been diagnosed with high blood pressure or diabetes already, educate yourself on what you can do to control your disease. Now, one thing I found that really affects minorities is we don't talk about issues. A lot of people come in and don't even know their medical history. And genetics has a factor to play. So if you don't know your parents had high blood pressure or diabetes, you don't know to screen yourself because you don't know you're at risk. So a lot of times we don't talk about these issues. So if it's something you're dealing with, educate your family members. Let your kids know so they can start getting screenings earlier, because a parent has it, the kid is at higher risk. It's not something to keep us as a secret, because you talking about it could help the next person prevent organ damage from something that is preventable. Let me just put it that way. But anyway, educate yourself, find out ways in which you can manage your disease. Because one thing I've also seen in our practice, a lot of times, African Americans especially, which is just from what I've experienced, it's a lot harder to manage their blood pressure when they come in so late, right? And it could happen with anybody else if your diagnosis happens so late, but in my practice, I've seen it more with African Americans get really high blood pressure. It's been hard to manage simply because I think we wait too late, and then it's hard to control it at that time. But there are things you can do dietary wise to help control some of these issues, and we'll talk about that later. Secondly, advocate for yourself, right? If you have something and you know someone else who could be at risk or has some symptoms, teach them, educate them, tell them to go for testing or screening, right? Advocate yourself when you go to the ER, when you go to the hospital and you're having some symptoms and you don't know what's going on. Advocate for yourself, push, and request for help until you get answers to what's happening, right? Or what's going on with your body. If you have a nurse friend or a nurse family member that you can talk to and can give you tips on how to navigate the health system, please talk to them, because you have to be a strong advocate for yourself, right? I always think about the story about Serena Williams, who had to fight, even as a celebrity, to advocate for herself when she had her daughter. And that's how, she was diagnosed with a PE early. And fortunately, was able to leave the hospital healthy. That doesn't happen with everybody. So talk, ask if you can advocate for yourself. Please try to have a family member and a game plan in place who can advocate for you, right? Get your physical. That's my third thing, and I'm gonna end there because this is a little bit longer than I wanted to. But get your physical. A lot of people don't even get physical, so you don't know what's going on until it's too late. Once a year, go into your provider's office, ask for a physical. They'll check your blood pressure, they'll check your heart rate, they'll listen to your heart, make sure your lungs are good, do some basic screening blood tests, and that's how we find a lot of issues, you know. If there's diabetes going on, they can check your sugar and screen you. Come in for your screening, right? It's very important that you try to get in and get that screening done once a year. So if they find something, they can start treating it early. And if you don't have insurance, there are resources, right? During this pandemic, we made some changes to our business model. So our office visits now are $50. So you could literally come in and get a screening. And our lab pricing starts at like $10. It's pretty affordable. And if you just need a blood pressure check or a quick blood sugar, we're not even going to charge you for that. Just come in, let us know you just want a quick check, and we're going to help you out because you need to have that information. You need to know those numbers, so you learn how to take care of yourself, right? Anyway, that is my soapbox for today. I hope and I pray this helps some of our minority individuals, and quite frankly, everybody should be getting annual health screenings to know your risk factors, but especially minorities. Please take care of yourself. I went to Grambling State University, and I had a classmate I learned this quote from, and she said, a closed mouth doesn't get fed, right? If you don't ask for help, there is no way we can know to help you. So speak up. You know, you're your best advocate. Speak up and ask for help. And we're open, we're accepting new patients right now. And I actually, I'm gonna do this for the community. We do have a couple of glucometers that we're gonna give out. If you're uninsured and you need diabetes care, reach out to us. We might be able to supply you. If you've just been diagnosed and you're not sure what to do and just need some education, please reach out to us. We might be able to supply you with some free glucometers, test strips, lancets, to at least get you started and set up so you can take care of yourself, right? Because it's very, very important. So, and we're gonna be here. We can do the blood pressure checks and the glucose checks. Just ask for help. You can contact us by calling or texting 817-612-1551, or you can visit our website at www.jordanfamilyclinic.com, and I will be posting on our page on Facebook and any other outreaches and stuff. Right now, I know we got our hands on some glucometers, and we're just gonna give them out first come, first serve. So if you're a diabetic and you need any help and you don't have insurance, reach out to us. Thank you. You guys have a wonderful month. Stay safe with all the coronavirus going on. And actually, the coronavirus is one of the things that have exposed the health disparities, because now they're wondering why minority populations like African Americans are having a higher mortality rate from the coronavirus. And it's simply because we're more high risk. You know, we're probably going in with chronic issues that we did not know about. Or even if we know about the high blood pressure, the diabetes, the asthma, right? Because asthma too is more prominent in African Americans. But you have all this high risk diseases, all these diseases that put you at high risk for the coronavirus. And if you don't get your care early enough, unfortunately, we're having a higher mortality rate, and that is so sad. But if there's any way we can help, let us know. You guys have a wonderful week. Take care.